Hello, NCLEX Crusaders. Welcome to another live training on NCLEX Crusade International. If you're preparing for the NCLEX or you are a nursing student and you're trying to identify what is the best way to interpret an arterial blood gas, today I will show you an excellent strategy that will make your life much easier, and it will show you how to interpret effectively, easy, and in a very fast way an arterial blood gas. So I welcome each one of you to today's live training on our YouTube channel, the Tic-Tac-Toe strategy. So if you're here new on NCLEX Crusade International and you're seeing this video live, go ahead and comment in the comment section where you're joining from. If you're seeing this video later on, recorded, then do it as well. I want to know where everyone is joining from so I can welcome you to our academy. So let's go strictly to what we are here for, which is to train you, to help you prepare for the NCLEX, and also if you are in the nursing program, this training will also help you. Usually, or at least up to now, you have heard me talking about prioritization strategies, critical thinking. Today, we will go a little bit away from critical thinking and we will discuss some content relating to arterial blood gas interpretation. And like I promised, we are going to talk about the tic-tac-toe strategy. So do not move from that chair or that car, wherever you are watching this live video, live training. This is getting very interesting. I will practice some questions with you. I will show you how to use this tic-tac-toe strategy. And at the end, I will give you an excellent tool that you can use to practice these types of questions. Are you ready? Let's begin. So what is the tic-tac-toe strategy? I don't know if you remember when you were younger, maybe a child, and you played with a family member, with a friend, the tic-tac-toe. Remember this game? You know, the little circle, the X, and whoever had 3 in a row won the game. Well, we are going to fall back to those years where you played probably like every day the tic-tac-toe. It may seem childish, but I will tell you this. This is the best strategy that I have learned so far to interpret arterial blood gases. I remember back in nursing school, they were teaching us the Rowe method. And the Rowe method, it is an excellent tool to use to interpret an arterial blood gas, but it gets a little bit confusing. And also, the biggest problem with the Rowe method is that you do not know the compensatory mechanisms. Like for example, using the Rowe method, you'll be able to identify if you have respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic alkalosis, but you are not able to tell, at least not graphically, if it is partially compensated, uncompensated, or fully compensated. And with this tic-tac-toe strategy, you will see how easy it is to do this. So, how do you do the tic-tac-toe? How do you use the tic-tac-toe to interpret an arterial blood gas? As you can see in front of you, you have the tic-tac-toe graph. Remember these steps. On the left side of the graph of the tic-tac-toe, you will put acidic or acidosis. In the center, you will put normal values. And on the right side, you will put basic or alkalosis. And I will show you step by step how to use this strategy, and you will see different scenarios. So I don't know if you're ready to practice, but I am. Are you ready to practice? Are you ready to do some questions with me? We're gonna do several questions and we'll take it one step at a time. Remember, at the beginning, since this is new, it might be a little bit confusing, but have some faith. give it a shot. Listen to it from beginning to end, but above all, practice the strategy. Remember, in the NCLEX, you're not likely to find questions that you have to use this strategy to identify if you have a respiratory or metabolic acidosis or alkalosis, but they will include arterial blood gases results in the NCLEX question stem, and you have to interpret it first before you identify what's normal, what's abnormal, or what is the priority. So bottom line, you have to learn how to interpret ABGs. If you are in the nursing program, that is totally different. They will ask you to use this strategy. They will ask you to interpret ABGs on maybe a med-surg exam, maybe a midterm exam, a pharmacology exam. So definitely learn this strategy. So let's go with the first scenario. And this is the first scenario. The pH in this scenario is 7.23. The PaCO2 is 29, and the HCO3, or bicarbonate, is 12. Before we begin using the tic-tac-toe strategy, remember this. There are 3 important factors to interpret an arterial blood gas. Basic factors. Remember, on the NCLEX, you will be doing basic ABG interpretation. You need pH, you need CO2, and you need bicarbonate. First, you need to know the normal range. In other words, what is normal? What is a normal pH? What is a normal CO2? What is a normal bicarbonate? So if you can comment in the comment section, what do you think are normal values for pH, CO2, and HCO3 or bicarbonate? I want to know if you know this normal range or normal values. Let me discuss something with you. In different bibliographies, in different nursing books, I have seen some discrepancies on lab values, not only on arterial blood gas interpretation, but other lab values in general. This is something that for a while concerned me, and in one of the meetings, one of the annual meetings for the NCSBN that my wife and I were able to attend, I asked this question: why different nursing books have different values to identify what is normal and not normal, and what is a nursing student supposed to use on the NCLEX? Because, for example, let me give you an example. Bicarbonate. Some books says that the bicarbonate normal value is from 22 to 26, while other books says, like for example, the Saunders book says from 21 to 28. So as you can see, there are some discrepancies there with the values. What are you supposed to do for the NCLEX? Which book are you going to follow? So I asked this question in the NCSBN annual meeting, and basically what they said, their response was, whenever they give you values in the NCLEX, they will give you values that are usually extreme. For example, if they're talking about bicarbonate, they will not give you 20, 21, because they know that this is a problem. They will usually give you extreme values like 15, 14, 11. So it is very, very clear that you have a bicarbonate value. So this is important for you to know. I see some of you responding in the comment section. The normal pH, it is from 7.35 to 7.45. Excellent. The CO2, remember CO2, it is similar to pH, just take the 7 away. So pH 7.35 to 7.45. CO2, take the 7 away, 35 to 45. That is normal CO2 values. And for bicarbonate, the ones that I use, the ones that I've seen the most, I've seen in different bibliographies, is from 22 to 26. That is the bicarbonate value that I use and I've seen most references using. Okay, so it is up to you what value you want to follow, what book you want to follow. But what I show my students is this one, ACO3 22 to 26, and we've had hundreds of students that have taken the NCLEX and passed the NCLEX. So now that you know normal range values for pH, CO2, and bicarbonate, let's use the tic-tac-toe strategy. So what we are going to do, the first thing that we are going to look is the pH. So number one, look at the pH and determine where it is on the scale. So in this scenario, the pH is 7.23, and we know that normal is 7.35 to 7.45. So where are we going to put the pH? Acidic, normal, or basic, or alkalosis. Remember, basic and alkalosis, same thing. So the pH 7.23 is acidic. So we are going to put it here under acid. The CO2 is 29. Remembering the normal values of CO2, 35 to 45, 29 is under the normal range. So we have little CO2 or carbon dioxide. Now, a CO2 of 29, is that acidic, normal, or basic? A CO2 of 29 is basic. Now, I'll show you a trick that I like to use because I see a lot of students getting confused with the CO2. Remember what the CO2 represents. CO2 represents carbonic acid, okay? So remember, if there is too much CO2, there is too much carbonic acid. So a high CO2, higher than 45, means more acid. So a CO2 of 29 in this scenario is less acid. So we will put CO2 under basic in this scenario. Now let's look at bicarbonate, ACO3. And we're going to use the range 22 to 26. So ACO3 is 12, is under the normal range. We are going to put the bicarbonate, ACO3, under acid. And now we are going to play tic-tac-toe. Remember the tic-tac-toe? Whoever had like three next to each other was the one that won. We have it here. We have acid, pH, and bicarbonate. But we have to translate this to an actual problem. So what do we call when the pH is acid and the bicarbonate is in acidosis land? We call this metabolic acidosis. Why metabolic acidosis? Because remember that bicarbonate represents metabolic, while CO2 represents or corresponds to a respiratory problem. So we have acid, the pH is acid, and what's causing the acidic problem is bicarbonate. So we have metabolic acidosis. Now, we are not done. We have to identify, is it partially compensated or is it uncompensated? And we are going to look at what the CO2 is doing. This is going to be extremely important. So we know that the bicarbonate is in acidosis and the pH is in acidosis, but look at the CO2 is in basic or alkalosis. So what is the CO2 doing? If the bicarbonate is on acidosis and the CO2 is on basic or alkalosis, is compensating. The CO2 is basic, trying to compensate for the acidosis. But if you notice, the pH is still abnormal. So when this scenario is happening, we call it partially compensated metabolic acidosis. Do not confuse partially compensated with uncompensated, and you will see the difference. I will show you the difference in this YouTube Live. So first scenario, we have partially compensated metabolic acidosis. Now, you know the normal parameters now. You know how to do the tic-tac-toe. Let's do the next scenario, but let's do it a little bit faster. The next scenario, the pH is 7.47. So you have to do the same thing. Identify whether the pH is acid, normal, or basic. A normal pH is 7.35 to 7.45. So in this scenario, the pH is higher than normal, above 7.45. So the pH in this scenario is going to be basic. Now let's look at the CO2. The CO2 is 62. Remember the normal range, 35 to 45. Now we have too much CO2 above 45. We have too much carbonic acid. We have too much acid. So CO2 is acidic. The CO2, we're going to put it under acidic. Now let's look at the bicarbonate, HCO3. Bicarbonate is 44. Remember the normal range, 22 to 26. So too much bicarb, too much bicarbonate. 44. So we're going to put the bicarbonate under basic. So now what do we have? Let's play tic-tac-toe. The pH is alkalotic. The bicarbonate is alkalotic. So we have metabolic alkalosis. We have metabolic alkalosis. Now, look what the CO2 is doing. It's on the opposite side. CO2 is now on acidic, while bicarbonate is on basic or alkalosis. It's compensating one another, but the pH is still abnormal. So what do we have? Partially compensated metabolic alkalosis. So now this is the second scenario that we have seen so far. Okay? So professor, why? Why is this called partially compensated metabolic alkalosis? Very simple. The pH is in alkalosis. The bicarbonate is in alkalosis. In other words, what's causing the alkalosis is the levels of bicarbonate. And remember that bicarbonate represents metabolic. So metabolic alkalosis, that part is clear. Now, is it partially compensated or uncompensated? It is partially compensated. Why? The CO2 is on acidosis trying to compensate, but the pH is still abnormal. That is why it's called partially. It's trying to compensate, but it's not strong enough to pull the pH back to normal. You see, in this same scenario, if the pH was normal, then it would be fully compensated. But that is another scenario to practice, and we will practice that scenario on this YouTube live training as well. But I want to make sure that you're understanding this. I see on the comment section, Professor, I see that the CO2 is high which is alkalotic. This is incorrect. Remember, when the CO2 is high, that can take the patient to an acidotic problem. And think about this. For example, what do we see on a patient that has COPD and is uncompensated? We have a patient with COPD problem. The patient is struggling to breathe, he has a chronic condition, but now has exacerbation of COPD. What do we usually see? We usually see a pH that is low, below 7.35, but we see a CO2 that is high. So that is what we see in respiratory acidosis in a patient with COPD. So therefore, you have to say, if the CO2 is high, that means that the CO2 is acidic. This is important for you to understand. Okay? All right. Let's go to another problem. The pH now is 7.47. So again, we have a scenario that the pH is above normal range, 7.35 to 7.45. Now it's 7.47. So the pH is alkalotic or basic. The CO2 is 30. Remember the normal range? 35 to 45. Below 35, the CO2 is basic or alkalotic. And the bicarbonate or HCO3 is 19. It is below normal range, and we're gonna put the HCO3 or bicarbonate under acidic. Okay? Perfect. Let me take this this call away so you don't hear on the streaming. There you go. Okay, so the bicarbonate or HCO3 is acidic. Let's play tic-tac-toe. The pH is basic and CO2 is basic. What does CO2 represent? CO2 represents a respiratory problem. And in this scenario, the problem is alkalosis. So what do we have? Respiratory alkalosis. Now, is it partially compensated or is it uncompensated? Well, what is the bicarbonate doing now? The CO2 is in alkalosis and the bicarbonate is in acidosis. It's on the other end. It's compensating, but the pH is still in alkalosis. The pH has not returned to normal range. So what do we have? Partially compensated respiratory alkalosis. Okay? Partially compensated respiratory alkalosis. All right. I see some of you still putting uncompensated. It's not uncompensated. It is partially compensated. I will show you a scenario that it is uncompensated so you can see the difference, okay? It is a little bit different to see partially compensated and uncompensated, all right? There you go. All right, let's see the next scenario. The pH is now 7.30. Where are we going to put the pH? Acidic, normal, or basic? So pH is below 7.35, acidic. Where is the CO2? 50. What is normal range? 35 to 45. So 50 is above 45. So too much CO2, too much carbonic acid, too much acid, CO2, we're going to put it under acidosis. And where is bicarb? Where is bicarbonate? HCO3, 30. Normal range, 22 to 26. So too much bicarb, we're going to put it on basic or alkalosis. Let's play tic-tac-toe. Tic-tac-toe. Who won? Acid, pH, and CO2. We know that CO2 represents a respiratory problem. So what do we have? Respiratory acidosis. Now, is it uncompensated or is it partially compensated? What is the bicarbonate HCO3 doing? It's on the opposite end. So we have CO2 on acidosis and we have bicarbonate on alkalosis or basic. So it's compensating, but only partially because the pH is still abnormal. So what do we have? Partially compensated respiratory acidosis. All right, let's see another scenario. We have pH 7.30. Where are we going to put the pH? In acidosis. Remember that 7.30 is below the normal. CO2 is 50. So we have too much CO2. So we're going to put the CO2 under acidic. The bicarbonate now is 24. And we know that the normal range is 22 to 26. So we're going to put bicarbonate under normal. We have a different scenario now. Remember that in comparison to what we've seen so far, this is different. Because now we have bicarbonate normal. So let's play tic-tac-toe. We have acid, pH, and CO2. We know that CO2 represents respiratory, so we have respiratory acidosis. What is the bicarbonate doing? Nothing. The bicarbonate is chilling, normal. The bicarbonate is not compensating the acidosis. So what do we have? Uncompensated respiratory acidosis. So I would like to show you the difference here. As you can see, bicarbonate is normal and not doing anything to compensate for the acidosis problem. However, if we take bicarbonate from normal, let's take it out of here, and let's put bicarbonate here, and let's say that the HCO3 instead of 24 is like 32, then it is different. It is not uncompensated anymore. It is partially compensated. That's how you know the difference. If you see that the bicarbonate is on the opposite end of CO2, then you know that there is some kind of compensation. So this is the normal scenario. HCO3, normal range. CO2 in acidosis. pH in acidosis. We have a respiratory problem. It's called respiratory acidosis, and the bicarbonate, instead of going to basic to compensate, is normal. That is called uncompensated respiratory acidosis. All right? Excellent. Let's go to the next scenario. The pH is 7.47. So we have the pH above normal range. Normal range, again, 7.35 to 7.45. The pH is 7.47, so we're going to put pH under basic. The CO2 is 30. Below normal range, we're going to put CO2 under basic. And bicarbonate, HCO3, is 25. Again, normal. So we have an alkalosis problem, and the one that is causing the alkalosis is CO2, which represents a respiratory problem. Therefore, we have respiratory alkalosis. Now, what is the bicarbonate doing? Is it compensating? Nope. It's in the middle, normal. The bicarbonate is not doing anything to compensate. How do we call this? Uncompensated respiratory alkalosis. I encourage each one of you to go back to the video and see each step by step, because this can be very confusing at first. So once this live is done, go back to this video and review everything from beginning to end. Pause, take notes, try yourself to see if you're understanding these concepts. Because once you really understand how to use the tic-tac-toe, it is going to make your life easier. My students love this tic-tac-toe strategy. They love it. When I teach it in our academy, they love it. Okay? So we've seen so far several scenarios. We saw respiratory acidosis, partially compensated. We saw respiratory alkalosis, partially compensated. We saw metabolic acidosis, partially compensated, and metabolic alkalosis, partially compensated. And we also saw different uncompensated scenarios. Now, there is another scenario that I want to teach you, and I want you to see it here in this training. This last scenario is a little bit more challenging because you have to do an extra step. Before we get to that last examples, two more examples, and I show you an excellent tool that you can use to practice this type of questions, I want you to subscribe to our YouTube channel if you haven't done so. Go ahead and click the subscribe button so you don't miss any of our live training. And also make sure you have liked our video if you like it, only if you like it, and show us that support for our YouTube channel. I always appreciate all of you that like our videos every time you're here, either watching a live YouTube or a recorded YouTube, because it really helps us to get to other students out there. We have right now 289 students live, and we have 152 likes, so we're getting there. Please help us out. Professor, I'm confused with the CO2. Remember, I'm going to say this once again. You have to look at this video slowly. Right now, in the live streaming, it's too fast, and it might be going too fast for you, okay? Go back and listen step by step. Trust me, this is the best method to analyze ABGs, the best one. I know a lot of methods, but this is the best one. But it takes some time to learn because there is a game with numbers. What is acidosis? What is alkalosis? The first thing that you need to know is the normal range. What is normal? If you don't know what is normal, you won't be able to learn how to interpret ABGs. So learn what's normal. pH 7.35 to 7.45. CO2 35 to 45. HCO3 22 to 26. Now you know the normal values you can identify. Well, what do I have? Normal, acidosis, or alkalosis. The one that usually creates the most trouble understanding is CO2, because there are a lot of people saying a lot of bad things out there, okay? But remember this, no doubt in my mind, if the CO2 is high above 45, you could have an acidosis problem. Remember, CO2, carbon dioxide, represents carbonic acid. If it's too much CO2 in the bloodstream, there is too much carbonic acid, which could take the patient to acidosis, usually on a respiratory problem like COPD. But like I said, once again, go back and review each one step by step. All right, guys. As you know, we have created a Telegram group that you can join us and be informed of anything that we're doing in our academy, any live classes, or any YouTube live that we might be giving for the week, or any new videos coming out. I always inform my students on this Telegram group. I have pinned this link on the top of the comment section, and I will also include it in the comment section once I have completed this YouTube training. So make sure you are joining our YouTube, subscribing to our YouTube, liking our videos, and also joining the Telegram group, okay? All right. Excellent. Well, we're not done. We're going to continue learning, and let's go to another scenario. What do you think so far? Do you like this strategy? Do you like this method? I know it might be something completely new. And also, have this in mind. If you're using something other than the tic-tac-toe strategy and it's working for you and you know how to interpret an ABG clearly, do not change it. Do not change anything for this. But if you're struggling with it, if you're making a lot of mistakes, try the tic-tac-toe strategy and it will help you a lot. Okay? All right. Let's go to the next scenario. We have a pH that is 7.43. Now the pH is normal. Remember normal values for pH, 7.35 to 7.45. The pH is 7.43 normal. The CO2 is 28. The CO2 is below 35. We're going to put it on the CO2 basic. And bicarbonate is 18. So bicarbonate is acidic. So what do we have now? We have a normal pH, but the CO2 and bicarbonate are not normal. One is on acidosis and the other one is on basic or alkalosis. What's going on? We have a balancing game between ACO3 and CO2, and the compensation is enough that brought the pH back to normal. So we have fully compensated, but we still have to identify what is the basic problem. What brought the problem? What is the beginning of this? Because yes, it is fully compensated, but I need something else. I'm going to show you a trick that you can use to identify, okay? So that's why I say that you have to do an extra step to identify this scenario. So the pH is normal, but the pH is 7.43. I ask you a question. Is the pH more inclined towards acidic, or is the pH more inclined towards basic? In this case, the pH is more inclined towards basic. It is normal, yes, but it is 7.43, almost at 7.45. So it is closer to basic. Perfect. What is basic in this scenario? CO2. So we know that the problem is CO2. Where is the CO2 in alkalosis? So how do we call this? Fully compensated respiratory alkalosis. This is the way to do it when you don't have clinical manifestations of the patient. If they ask you, this is the ABG interpreted, and you don't have any clinical manifestations, you don't have a diagnosis, this is the way to do it for the NCLEX. Okay? You have to do an extra step. pH is normal, but it's more inclined towards alkalosis. And CO2 is in alkalosis or basic. CO2 represents respiratory. So we have respiratory alkalosis fully compensated by the bicarbonate, because the one that is compensated is the bicarbonate. Okay? Perfect. Let's do another scenario. In this scenario, the pH now, it is 7.38. It is normal, so we're going to put it under normal. The CO2 is 28, so it's under 35. We're going to put it on basic. The ACO3 or bicarbonate is 18. We're going to put the ACO3 under acidic. So, once again, we have a pH that is normal, we have an ACO3 that is on acidic, and we have a CO2 that is basic, and one is compensating the other. But in this scenario, the pH, it is closer towards acidosis. So what do we have? The pH is closer to acidosis and bicarbonate is on acidosis. We call this fully compensated metabolic acidosis. Now, a question that you may think, Professor, what happens if the pH is 7.40? It is not more inclined towards one side or the other, it's exactly 7.40. In the NCLEX, they will not give you that scenario. Why? If the pH is in the middle, 7.40, and it's not inclined towards one or the other, you have to use a specific formula and they have to give you clinical manifestations. Therefore, that is for another test, not for a nursing test that is advanced ABG interpretation. Okay? Perfect. As I promised, I was going to share with you a tool that you can use to practice more questions. Remember this. I got these questions from the same tool. You can use it to practice. Excellent. Excellent tool to really get the hang of ABG interpretation. So where do you find this tool? You're going to go to www.abg.ninja/ABG. And you're going to get to this website and it's going to show a problem just like you see in the computer right now. They're going to give you a problem. They're going to give you the pH. They're going to give you the CO2. They're going to give you the bicarbonate. And you will use the tic-tac-toe. You'll get a piece of paper and you do the tic-tac-toe. For example, they say that the pH is 7.29. So let's do the tic-tac-toe together. For this scenario, we put acidic, we put normal, and we put basic. So pH is 7.29. The pH is below 7.35, so we're going to put the pH in acidosis. The CO2 is 35. So we know that CO2 normal levels is 35 to 45. So the CO2 is normal. And bicarbonate is 16, which is below the normal range. So we're going to put bicarbonate in acidosis. So let's play tic-tac-toe. Acidic, pH, bicarbonate. What does bicarbonate represent? Metabolic. So what do we have? Metabolic acidosis. The CO2 is not compensated, so we have uncompensated metabolic acidosis. So once you're logged in on this site, it's completely free. You don't have to pay anything for that. You're going to click here, metabolic acidosis. Then level of compensation, you're going to click none, and compensation none. And then once you start clicking on this, it will give you the answer here. Like you can see, uncompensated metabolic acidosis. If you're ready to submit your answer, you're going to click where it says check. And it will take you to a page like this. If you got it correctly, it will give you a green check mark. If you got it incorrectly, it will give you a big X, red. The page will turn red. And then it will give you the answer here. See, this is the answer. And this is the answer that you provided. If it matches, then the answer is correct. If you want to try another one, you click try another one, and it will take you to a different scenario. So remember, go to abgninja/ABG. This is a completely free resource. I have used it many of times. I use it to practice questions with my students, and I encourage each one of you to use it to practice yourself. So this is it for today's live on our YouTube channel. Our next YouTube channel, we're going to start giving some training on respiratory acidosis, alkalosis, metabolic acidosis, alkalosis, how to identify the cause, what are some clinical manifestations that are seen in these patients, and we will practice some questions together. So do not miss our next YouTube live. We will go into deeper details on how to answer style questions regarding ABG interpretation, and also how to use critical thinking to answer this NCLEX style of questions. Thank you very much. I hope that you found this YouTube live helpful and that you are joining us every week, usually Wednesdays or Thursday at 5 p.m. Thank you very much, family. God bless you. Bye.